Why is it swollen down there? Why does my labia look like this? When will things ever feel normal again? If you've ever had these questions after giving birth, you are not alone. And today, we are going to answer all of those burning questions. My name is Dr. Pindalet Choa. I'm your postpartum expert and the host of Fourth Trimester Voices podcast. Today, I'm joined by Dr. Carine-Ange Tagni, a sexual and intimate wellness expert and labioplasty surgeon, otherwise known as your vagina beautician. Dr. Tagni helps women navigate some of the most common but least talked about vaginal changes after birth. Together, we are going to dive into what is normal, when to seek out help, and how to feel confident in your body again. Welcome to Fourth Trimester Voices, the podcast where we delve deep into the fourth trimester. I'm your host, Dr. Choa. Welcome, friend. Yes.
Thank you for having me.
Absolutely. So we were at a conference this weekend. We went to a women in
Yes.
medicine conference, and so many wonderful things were happening there. One of the things that I noticed is that every time we told people what my friend over here does for a living, people's eyes were like, oh my gosh, I need to go and see you. So I just thought it would be a really great episode to come and talk about what is happening down there postpartum
Yes.
and how to fix it. But
Yeah.
girl, tell the audience what you do. Who are you?
Well, I think you did a great job at that.
Yeah.
Okay. But I am Dr. Carine-Ange Tagni, and I'm a board certified OBGYN. My current focus is intimate wellness with a special lens on hormone aware care. I have training as a labioplasty surgeon, and I take tremendous pleasure in making women feel great in the space of intimacy. I want you to feel good when you engage with your partner. And how can I achieve that with you? That's why I'm here.
Absolutely. So I want to set the stage. A woman just gave birth. She had
Uh-huh.
through 9 months carrying this baby. Her vagina, I don't even know if YouTube is going to flag this word, but her vagina has gone through changes, right? Massive
Mm.
changes. There are hormonal changes, and no one really prepares women for what is going to happen.
Yeah.
So just tell me, walk me through what is happening with the woman's body as she's going through pregnancy and childbirth that affect her postpartum journey.
Yes. So one of the things that surprises women the most, outside of the weight gain that we expect to have during pregnancy, are the changes that our body experiences, areas that we don't always look at until we have to, such as the vagina. We are always like, am I getting too much weight in my waist? Oh, my breast is getting engorged. All of those changes that are hormonally driven with pregnancy and expected are what we are prepared for. But what we are not prepared for is the labia appearance during and after pregnancy. A lot of women, after they give birth and they start to look at things down there, they call me and they're like, what is going on? I don't recognize myself. What has happened? And we have a little laugh, and I say, those hormonal changes for getting your body ready, guess what? They don't pick and choose where they go. Those changes happen throughout your body, and your labia, your vagina, are also exposed to it. The swelling that you see, the skin texture that you perceive, the lengthening of the labia, all of those changes are due to the hormonal patterns that had to take place for pregnancy
Mm.
and that linger postpartum.
Mm. So I know one of the things you mentioned swelling, right?
Yes.
I was hosting a baby shower a couple months back, and a woman wrote on a card because she didn't want to say this out loud, but she wrote on a card that her labia. Her vulva is huge. She was like, I am so swollen. It feels like someone
Yeah.
literally put
Yeah.
water down there. And she was asking what device can she use to basically keep the labia up. And for the first time, the pelvic floor therapist chimed in and
Yeah.
they had something like a jock strap or something
Yeah.
to keep
Yeah.
it. Talk about the swelling because I didn't go through that major swelling in my vulvas. Does that continue postpartum?
It could be so challenging because it literally feels like you have weight in that area and it can be quite uncomfortable. And if you can imagine your day to day activities, walking, just walking, that chafing that you experience with, and that can cause little breaks in the skin. Women experience that because of how swollen things are, the labia. And when they rub, when you walk, it can hurt, right? And you think about wearing your leggings, your jeans, things that you don't even on the regular basis, you're not questioning if it's going to be uncomfortable. But when you have that amount of swelling, it can definitely impact your day-to-day life. If you take it into the space of intimacy, people get weirded out by it. They get self-conscious, they get uncomfortable. So during pregnancy, you don't have as much resources to address it. Pelvic floor therapy is a great way. They have tools to support because what's happening is that you have gravity and excessive blood flow and the change of the tissue in itself. You accumulate water and blood, excessive blood to the area. So by giving some support, it helps to compress the area and decrease that sensation. During pregnancy, that's pretty much what we can do. But after pregnancy, that's when you want to call me, right? Because there's a lot more that we can discuss depending on how long it lingers. Some women after delivery, it goes away after 6 to 12 weeks. Other women, they come see me and it's still lingering and they feel like they want to change that. They don't want to stay like that forever. So that's when we talk about various things we can talk about a little bit.
Later. How about sitz baths or cold packs? Does that do anything postpartum?
Not really. Because it's not an injury. It's just a change of the vasculature that is in the skin texture. So if you apply measures like sitz baths, cold, it's just gonna be temporary. You're gonna feel a very temporary relief, right? Not even 24 hours. Whereas when you're wearing a device, I don't know if you remember when we were struggling with pelvic bone discomfort and we were wearing these pregnancy belts. It worked when we had it on, right? And then once you take it off, the pain returns. So it's a similar kind of concept where you're providing support.
Mm.
But if it progresses after pregnancy, that's when we can get into non-surgical approaches, surgical approaches. What can we actually do? Any interventions that can change the texture of the area and decrease the amount of fluid and blood flow.
Okay. Well, let's talk about that a little bit because before we move inside into the vagina, the exterior a little bit, you talked about the swelling. I know a lot of women also complain about labia stretching, right? Or their labia now
Yes.
looking
Yes.
different or it doesn't look symmetrical. Is this a new normal for women or, is this these labial changes, are they going to go away? And at what point does a woman say, I need to get a labiaplasty. I need to go see the vagina beautician to help me out. At what point do moms have to make this decision postpartum? Because, they tell you things postpartum will eventually come to an end. Linger.
Yes.
So when do
Yes.
they come and see you?
Well, I have to tell you, it's a very, very personal process.
Mm.
Some women don't find it to be bothersome. To them, it's like, okay, I became a mom and that's it. Other women, it starts to impact their confidence. It starts to impact their relationship. It starts to impact their activities. And they pause and say, well, if this is impacting me and I'm thinking about it that much, I probably should do something about it.
Yeah.
But the problem is they don't usually know where to go. When you go see your doctor
Yeah,
and they clear you for sex and exercise, right? 6 weeks, you good, mama, bye. When was the last time someone asked you, how do you feel about that labia, mama?
No one's
Right?
asking that specific
No
question.
one is asking that. So women don't necessarily feel empowered to bring it up. They will ask me, is it going to be like this forever?
Mm.
They don't necessarily know that there's something that could be done about it. So the way I go about it, I tell women, does it bother you? If it bothers you, let's talk about it. If it doesn't bother you, alone. Those changes typically What I find is no one really knows. I think there's a layer of genetics. Some people go through the hormonal changes and the labia will lengthen, right? And they will have skin laxity. It will look a little bit more wrinkled. The texture will change. It looks a little bit older.
Mm.
And that just it remains like that, right? It never goes away. And then you have some women that go through those changes, and by the time you see them 6 weeks after, you can see how those changes are reversing.
Mm.
When you see them later down the road for the annual exam, for the gynecologic exam, they back to normal, right? So can I predict who is going to do what? No. But what I can do is, if it's bothering you and impacting your quality of life, I can offer you a solution.
I love the fact that there is a solution and that we're talking about this because there's somebody out there who's definitely looking down there and being like, how do I even have this conversation? So I'm so happy that you're shining a light and there is a resource in Philadelphia area to be able to get this done. I want to transition a little bit and talk about dryness. We know a lot of women not only suffer issues with their labia, but there is a lot of dryness. This is very much hormonal. Explain why hormonal changes bring a woman to feel like it's a desert down there and ignore their spouse.
Who wants to have dry sex? Nobody. What I always try to do is to educate my patients first. Why is it happening?
Yeah.
If a patient is breastfeeding, for example, let's take a common example of breastfeeding. Breastfeeding, the changes that are linked to breastfeeding and the relationship with the vagina and what's happening there is very much hormonal. But what's happening is that most women that breastfeed experience vaginal dryness. You're not going to tell her to stop breastfeeding because she has vaginal dryness. She's not going to want to do that, right? Because the priority is to feed her child. But what women end up doing is that they try different kind of lube, all sort of things to make that process less challenging.
Right.
Now, when they come see me, what they find out is, hey, outside of the lube that you've been trying, guess what we can do here? I can give you a 30-minute or less treatment that will change the texture of the vagina, increase lubrication, increase blood flow, and as a result, increase the collagen production. You see how when we take care of our skin on our face and we have all these treatment options to make sure that we are always moisturized and looking fresh, we can do the same thing in the vagina.
Okay.
And to, yeah,
Okay. You can
so that's
hydrate the
where
vagina. Is it like a noni
some
steam?
hydration procedure.
Is it like a
Yes.
noni steam?
Well, I'm not going to get into that. But what I can tell you is I can use energy based treatments. Usually, radio frequency energy is what I like to use, and apply a treatment that basically kickstarts the process of healing. And with the healing process, the production of new vaginal tissue, hydration, so that by the time they engage again with their partner, usually within the first 3 weeks, people are able to tell me, that was amazing. I had no dryness, right? So that treatment option is what I use. And currently, the method that I use is the treatment option I use is called Forma V. The idea is that with the application of radio frequency energy into the vagina, you can create new collagen. And when you create new collagen, you can also improve the hydration status of the vagina. More hydration means less dryness, which means more comfortable intercourse. That has no bearing on breastfeeding. It takes care of the hormonal changes without introducing any variables that will make them feel like, what am I putting in my body right now? So women do 3 sessions, 3 weeks apart, and they're done.
No creams, no drowning in lubricant or asking my doctor to write me some estrogen cream or anything like that.
Well, now that you mentioned that, the Vagina Princess always does a little bit too much, right? Because I like my patients to have the most amazing results. So yes, I will layer it with some vaginal estrogen. I have a few tricks up my sleeves, but what anchors my treatment for vaginal dryness specifically is the use of the radio frequency energy based treatment, which is underspoken. We don't talk about it enough, and it's changing people's lives literally when we talk about intimacy.
Any roleness in pelvic floor therapy for dryness?
Not necessarily. I tap in my pelvic floor therapist friends when there are elements of pain that could be
Okay.
related to tension muscles, because the vagina is a canal surrounded by muscles. Sometimes you have spasm, just like you can have a spasm in your neck, you will have spasm there that will cause pain. A lot of women actually have postpartum pelvic floor pain.
What a great segue. That was my next on there. We were going to talk
Yes.
about dyspareunia, vaginal pain. A lot of women, more than we think, actually suffer with vaginal pain. And that is because of a number of different reasons. There's scar tissue, there's tears, there's muscle tension. People may have had episiotomies. Dr. Carine, please tell us, what is normal healing pain versus what is troublesome, I now need to go see a doctor pain?
To answer your question best, I'm going to tell you a story of a patient of mine. She's in her late 30s and she has this new amazing baby. She's enjoying motherhood. And she tells me, things are different. I can't pin it, but I do not enjoy engaging with my husband anymore. And it really bothers me because we used to have this amazing bond, and it was a space that we will enter to reconnect. And even though now I create the time for it, which is not easy to do as a new mom, I do not enjoy entering that intimate space with him. So obviously, I hear that my ears go boop, boop. What's going on? With penetration, I have excessive amount of pain, which makes me pause, and he can sense my discomfort, and then the whole mood is ruined. In addition to that, I breastfeed. I have dryness as well, which makes the whole act a little bit awkward because every few minutes I have to reach out to use some vaginal lubricant. If that wasn't enough, every morning or sometimes during the day, I will have an accident where I lose urine, and that makes me feel really, really uncomfortable. This overall is changing the relationship I had with myself, with my husband, and it really bothers me to the point where I feel so self-conscious and it's impacting my well-being. Okay. I have patients like that all the time. So what's behind it is you have someone who has experienced childbearing and childbirth, and as a result, ended up, for whatever reason, injury that triggered a certain nerve response with penetration specifically, which is the whole reason why she's having pain, right? And then you layer it with the vaginal dryness that is hormonal. Finally, you top it off with incontinence, urinary incontinence, which is related to, for most women, pelvic floor relaxation, and for the other half, tension, which sometimes tension can lead to bladder dysfunction. Okay. So, someone like that is someone who needs a little bit more than the traditional approach that we usually have, which is we're going to send you to pelvic floor physical therapy. You do your therapy, you show up every week. Where I come in is I say, hey, I see the value of pelvic floor physical therapy, which is essential in your treatment plan. But guess what? I can make your experience better right now. And how do I do that? I walk her through what's happening in the vagina with the vascular changes, the tissue changes, and everything. And I say, with the use of energy-based treatment in the vagina today, we can start. And by 7 days from today, you will notice that you have more lubrication in the vagina. Number one. Number two, I can change your sexual satisfaction. How can I do that? I can enhance your nerve response by a simple injection where the G spot is, that also has regenerative properties and will increase the blood flow to the area. Blood flow means better tissue, collagen production, right? And finally, we can do some pelvic floor strengthening, rehab, with a pelvic floor therapist, and put your A team together to transform your sexual satisfaction, your intimacy experience, resolve the vaginal dryness, pelvic floor dysfunction, and the pain that you have penetration. That is what we're able to do today in 2025 for women. And most women don't know that. But it's a very common experience across the board. of experiencing those pain points we just mentioned.
I wonder how our providers can screen for this, right? So moms have one point with an OBGYN at 6 weeks. However, we may have people here on the podcast listening in on this, and they may be, maybe may not be a pelvic floor therapist, but maybe lactation consultant, or maybe a doula, maybe a sibling. How can we have these questions? Because we know that moms are impacted emotionally, their relationships in terms of intimacy. They feel a lot of shame, there's embarrassment, they keep quiet. How can the people around them ask these questions and be proactive about screening for them so that women know this is not like a bad thing? Maybe other women are going through this. How can we have these conversations as women?
Well, I think that normalizing the conversation is the first step, right? Which is why we're having this conversation, normalizing it and engaging our peers to introduce in their screening questionnaires that involve intimacy. The reason why that's important is because intimacy is an essential part of women's health,
Mm,
right? Women who struggle with intimacy have a higher rate of depression and anxiety. It can impact relationships. Marriage can break down. Women that do not experience safe, enjoyable intimacy have a hard time showing up in various spaces,
mm,
whether it's at work, whether it's as mom, whether it's as friends and wives, in a way that makes them feel well.
mm,
If we start to normalize the conversation and recognize that intimacy is an essential piece of wellness, we can even make it a metric of health.
mm,
We can start to have conversations and framework, clinical framework that empower providers to have these conversations in the office and then take it to the next step where we give them the tools, because a lot of the times providers don't have the tools. And once we frame it so that they can incorporate it in their screening questionnaires, they can have the tools to help their patients or the referral points, then you will find that women will start bringing it up more often. A woman who's avoiding running because postpartum, she's no longer running because she's leaking, that woman is now going to have some changes in her fitness, her
mm,
cardiovascular health, and so on and so forth, because she's no longer engaging into an activity that used to help her, right?
mm.
And I can take this even further. If you have a woman who is no longer engaging with her partner and no longer experiencing orgasm, we have studies that show that orgasm actually improve cardiovascular health,
Mm.
right? So Mother Nature did not give us that experience just out of whatever. It is something that is we are genetically wired to crave, right? But it's also beyond the sexual experience, it's the intimacy experience
Mm.
that brings that sense of wellness that we must be comfortable discussing and allowing women to tap into when we talk about women's health.
Absolutely. Powerful. I hope women understand when they listen to this that you don't have to deal with it. There are real solutions. Your body has done something incredible. Your
Mhm.
body is going through a lot of changes, and it's easy to say these are normal. You have no idea. So don't sit at home thinking my leaking is normal, my pain is,
Mhm.
my dryness is normal. Anything that is affecting your mental health, your body, overall wellness, and how you view yourself, please seek out help. If your OBGYN or midwife doesn't know how to necessarily deal with it, it depends. You have Dr. Corinne here, you have me in Atlanta. I have a lot of resources in my hand, and we want you to contact us to ask about these things. I'm going to ask Dr. Corinne to share with us as we close 3 top tips for women that they should know about their vulva and vagina health. I'm going to let her close out, give us some 3 tips, and also tell us how to reach her.
Okay, 3 tips.
Mm,
I will say the vulva needs to be moisturized. It has skin like the rest of our body, it gets dry, and sometimes that Chronic itching that you experiencing is linked to dryness. So
Mm.
moisturize the area. If the itching is persistent, you want to make sure that you talk to your gynecologist because there are other conditions that can cause chronic itching that must be dealt with. Moisturize your vulva. The vagina cleanses itself. It does not need help. There are a lot of products that we use to wash the vagina. If you are having trouble maintaining your vaginal pH, you probably need to incorporate some sort of probiotic that will help stabilize the normal environment of the vagina. We need healthy bacteria. It keeps things in balance. Nothing that you experiences down there should be normalized. It might be common, but it's not normal. So if it's bothering you, make sure that you seek help and talk about it. There are no shame around the topics. We are here. This is what we do for a living. And that's why we having these conversations so that you can feel empowered to ask the questions. Once you ask the question, we can lead you to the right solution. If you want to know more about what I do and how I can help you, follow me on IG. We're going to drop it in the chat. But if you have a pen, it's at DRTAGNIND, Tagni MD. You will find me there. And I'm also located in the Philadelphia area, and you can always call my office at 215 883 7333. Yes, 215 883 7333. So there's always someone available, and we will guide you regarding the first step and what we can do to help you. And that's about it.
And you take out-of-state travelers.
I do. I love my out of state traveler because we make it a fun experience. You come on a Friday, we make sure that you have a nice time in the Philly area. And so we have it all figured out. Just call us.
All right, wonderful. Thank you so much, Dr. Tagni, for coming on the
Thank you so much for
show.
having me.
Ladies and maybe gents who are watching this, thank you so much for tuning in and listening. If you have any questions, you know how to reach me, Dr. Choa at Instagram. Take
Thank
care.
you.
Bye. My name is Dr. Choa, and it's been lovely talking with you all today. Take care.